Hi, I'm Dr. Rafi Israel, and I'm here to talk about how to load a PalmScan packet tip into the PalmScan Pachymeter properly so you can have a perfect measurement every time. Let me start by talking about the PalmScan Pachymeter. PalmScan Pachymeter uses a very high frequency, high sensitivity transducer tip, as you can see over here, with a frequency of around 50 megahertz. We are able to use a sanitized tip to do patient pachymetry without cross-contamination. And the steps I show you is going to make loading of this tip very easy and produce very accurate, reproducible result every time. At this point, you're ready to load your pachymeter into the packet tip. I recommend using a mildly viscous drop like Refresh Tears. You put one drop of this into the packet tip that you want to use. Then you dry your transducer. Then the whole trick over here is to have a well that has no air separation between the pachymeter and the packet tip. So what I did was I just bent in firmly. I moved the tip a little bit so to make sure that the packet tip is not stuck to the bottom, and lifted it out. So at this point I do a small visual inspection to make sure that there is no air bubble on the sides, which it is okay. I start our pachymeter. Make sure that the tip cover is selected, and I usually also use time capture. The reason I use the time capture is when I press the start,
tip cover selected, get ready.
I want to see the multiple echoes from the tip. So this is the primary echo, this is the secondary echo, and tertiary echo, and so forth. And what that shows me is that there is a good ultrasonic coupling between the transducer and the packet tip. And that coupling is achieved by the fluid of the artificial tear. Now if that coupling doesn't exist, or if there is a small amount of air inside there, you will not get this multiple spikes, and that is indicate that you don't have a good coupling, therefore you're not going to get a good measurement. So anytime you see this, you're ready to go. Now I'm going to show you how to correctly measure the calibration card, and in process you will learn how to measure the eye properly. So for this, I place the timer about 5 seconds just to give me a time to confirm that I'm getting multiple.
Get ready.
There you go. So you can see red 538. What I want to talk about is noise. You want to put it on the card and make sure that you can see the two spikes.
Tip cover selected.
Sometimes there is extra noise on the card, so you want to be perpendicular so you get minimal. And what you want to get is basically two spikes, front of the card and the back of the card, and nothing in the middle. And you achieve that by moving the card, moving the probe until it gets rid of that middle spike if it's there, or you can decrease the gain because the gain on the card is a lot more than the gain on the cornea. So again, I use usually M1 or M2 when I do the cornea, and I always want to make sure that after I load the tip, I wiggle it a little bit so it's not stuck to the bottom, and gently lift it up, and I just check to make sure that there is no air in there, and then once I start,
Tip cover
I
selected.
look for multiple spikes, and when I see that, I know that the coupling is perfect. So when I
Tip
apply
cover
the machine,
selected.
when I apply it to the cornea,
Get ready.
you will get a perfect reading. Okay, and this is what you want to get in the cornea. You want to get a anterior corneal spike and a posterior endothelial spike. Now, if your endothelial spike is too low, what you can do is you can bring up the gain of the pachymeter. So I put it on medium 2,
Tip cover selected.
and we'll try it again.
Get ready.
So now I have much better gain over here, as you can see, and you get a very precise numbers with standard deviation of less than 2 micron.